That gnawing pain in your stomach? It might not just be stress. It could be a peptic ulcer, an open sore eating away at your stomach or intestines. But what causes these painful holes? And how can you heal them? Let's uncover the truth behind peptic ulcers. Peptic ulcer disease causes, prevention and cure. Peptic ulcers aren't just from too much stress. They're caused by two main culprits. The number one cause of ulcers, responsible for 60 to 80% of cases, is Helicobacter pylori, or H. pylori bacteria. This bacteria burrows into the stomach lining, weakening it, and is often contracted in childhood. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and aspirin, can erode the protective mucus layer in your stomach. Frequent or high-dose use increases the risk of developing ulcers, and even short-term use can trigger ulcers. There are other factors that can contribute to ulcer formation. Excessive alcohol consumption can irritate the stomach lining. Smoking, well, it slows down the healing process. Chronic stress can worsen symptoms, although it doesn't directly cause ulcers. And now, let's bust a common myth. No, spicy food doesn't cause ulcers. Spicy food can aggravate existing ulcers but doesn't create them. Preventing ulcers is easier than treating them. Here's how to protect your gut. Avoid NSAID overuse. Take them with food to reduce stomach irritation. Use the lowest effective dose and if possible, switch to acetaminophen, like Tylenol. Fight H. pylori infection by washing your hands frequently to prevent bacterial spread. If you think you might be infected, get tested and treated either through a breath or stool test. Limit alcohol and quit smoking. Manage stress through meditation or exercise. Eat probiotic-rich foods like yogurt and kefir. Ignoring ulcers can lead to life-threatening bleeding or perforation. The good news? Most ulcers can be completely cured with the right treatment. For H. pylori ulcers, the treatment usually involves a combination of medications. First, antibiotics are prescribed for a 2-week course to kill the bacteria. Next, proton pump inhibitors, or PPIs, are used to reduce stomach acid. Finally, bismuth subsalicylate is often recommended to coat and protect the ulcers. When it comes to NSAID-induced ulcers, the first step is to stop taking NSAIDs immediately. Then it's important to switch to safer pain relief options. To help the stomach lining heal, PPIs or H2 blockers are commonly used. In emergency cases such as bleeding ulcers, immediate medical intervention is crucial. Endoscopy is often used to stop the bleeding. In severe cases, a blood transfusion may be necessary. With proper treatment, most ulcers can heal within 4 to 8 weeks. It's important to follow your healthcare provider's recommendations to ensure a smooth recovery. Peptic ulcers don't have to be a life sentence. Get tested if you have symptoms, avoid unnecessary NSAIDs, and treat H. pylori early. Hit like if you found this helpful, subscribe for more gut health tips, and comment below. Have you or someone you know dealt with ulcers? Heal your gut and don't forget to grab your free ulcer diet guide.